Let's go on study. This is epinephrine. It also has another name, adrenaline. So we can use AD to describe it. This drug can be administered by several different administration routes. It's different from norepinephrine. Remember, norepinephrine, because of so obvious vasoconstriction caused by norepinephrine, we just administered intravascularly of norepinephrine. But epinephrine, compared with norepinephrine, its vasoconstriction effect is relatively mild, so it can be administered intravascularly, intramuscularly, and subcutaneously. It also can be administered by inhalation. Now, look at pharmacological effects. Its mechanism of action of epinephrine. Because it can activate alpha, beta-1, and beta-2 receptor. It has no obvious selectivity to the subtype of these alpha or beta receptors. So try to think of this receptor distribution and their function. So let's analyze the pharmacological effects based on this activation of receptors. First one, blood vessels. I told you, this agonist, different type of the receptors has different sensitivity to the agonist. Usually, beta receptor is more sensitive than alpha receptor. So when this drug used at the different dose, the effects maybe they are different. Now look at this epinephrine. When it used at relatively low dose on the blood vessels, it mainly activates beta-2 receptor, induce vasodilation, especially blood vessels in skeletal muscle. I also told you the density of beta-2 receptor is the highest in the blood vessels of skeletal muscle. When it used at high doses, so alpha-1 receptor also can be activated, induce vasoconstriction. This result is predominant, especially cutaneous, mucous membrane, and kidney blood vessels, even spleen and mesentery vessels. These blood vessels contract because of activation of alpha-1 receptor. But usually coronary and hepatic vessels dilated. This drug also activates beta-1 receptor, so increase the heart function. So metabolism of the cardiac cells also increased. The metabolized substance stimulates coronary vessels dilation. In the heart, usually the hepatic vessels, it also because of beta-2 receptor or caused by increased function of the liver, stimulates the vessels in the liver. That response also is dilation. So this is the blood vessels. Second, this drug, epinephrine, also can activate beta-1 receptor. So it has positive effect on the heart. It can cause positive inotropic and chronotropic action. So the final result is increased cardiac output. At the same time, because the heart work harder, so oxygen consumption increase. And it also has positive chronotropic, so maybe it also increase AV conduction. It has a latency to induce tachyarrhythmia. So here, there are many heart disease, including angina pectoris, myocardial infarction, and arrhythmias. So this result, for some patients with these problems, it always requires more caution. Yeah. Effects on respiratory tract. This drug can activate the beta-2 receptor, in the bronchial muscle. It induces bronchodilation. Similar to isoprenoline, this result is good for the patients with asthma, And it also can activate alpha-1 receptor, especially in the blood vessels of upper respiratory tract mucosa. It can induce this vasoconstriction because of activation of alpha-1 here. So the result is it has a significance of decongestant action. Sometimes this effect also is useful, when the upper respiratory tract has a digestion. Yeah, it is useful. Beta receptor, including alpha-1 receptor, also results in liver and pancreatic islet beta cells. So it can promote metabolism, increase the blood glucose. This is determined by beta-2 and alpha-2 receptor. So increase BMR. I think you know BMR, basic metabolic rate. Yeah. So here, it promotes metabolism, especially increase blood glucose. I think you can guess this result. For some patients, maybe it is a not good result. Right? Maybe you think of diabetes. Yes. Now, effects on the heart and on the blood vessels. This result also can alter blood pressure. So look at what is that change. When this drug is used at low dose, beta receptor is more sensitive. So act on the heart, induce increased cardiac output. So it mainly increases systolic blood pressure. Effects on the alpha-1 receptor in the blood vessels is relatively weak. Also, has a complex effects with beta-2 receptor in the blood vessels. So usually, the general results effects on blood vessels, its alteration is not obvious. Maybe no change of diastolic blood pressure. So the pulse pressure increase. But when epinephrine used in high doses, at these conditions, both alpha and beta receptor can be activated by epinephrine. So systolic blood pressure increase and diastolic blood pressure also increase. So the general result, pulse pressure, maybe it is not obvious, has no obvious change. Yeah. Now look at this figure. It shows the alteration of blood pressure caused by intravenous injection of epinephrine, just one time of administration. For a dog, intravenous injection of epinephrine at 1 microgram per kg, just once. So actually the blood pressure shows two phases of actions. At the beginning, it increases, so rapid and potent. and followed by decrease, even lower than the normal state. Now, actually, with the time goes by, it means after intravenous injection, just once, the drug in the body, it will has a rapid elimination. So the drug concentration of epinephrine, it is changed with the time. At the beginning, it means the concentration of epinephrine in plasma is relatively high. It is similar to use epinephrine at high dose. So effects of alpha-1 receptor activation predominate. So blood pressure increase, obviously. Beta-1 receptor also contributes to this result. With the elimination of epinephrine in the body, the drug concentration, it is declining. So here, it means epinephrine in the body, it is low concentration, similar to the effect caused by low doses of epinephrine. So here, beta receptor almost predominate. Alpha-1 is not very sensitive to epinephrine. At low dose, effects caused by alpha-1 almost disappear. So especially beta-2 receptor in the blood vessels induce vasodilation. So finally, maybe it also induces vasodilation. Blood pressure even decrease, even lower than the normal state. Understand? So this epinephrine effects on blood pressures induce the two phases. One phase is increase and followed by a decrease. This is the second phase. Are you clear? Okay, these are the pharmacological effects of epinephrine. So what are the clinical uses of it? And don't forget, another name of this drug is adrenaline. Let's go on. Based on the pharmacological effects of epinephrine, it can activate alpha and beta receptor. It induces vasoconstriction by alpha-1 or vasodilation by beta-2 receptor. Beta-2 receptor also induce bronchodilation. And beta-1 receptor induce positive effect on the heart. And alpha-1 receptor vasoconstriction, it has a significance of decongestive action. Remember that? Okay, so based on these effects, epinephrine, it is really useful in the clinical practice. Now, the first conditions is use this epinephrine to treat anaphylactic shock. It also caused by allergic shock. In the treatment of allergic shock, this drug is the most important. So we should select adrenaline first. Actually, anaphylactic shock is the syndrome characterized by bronchospasm, mucous membrane congestion, angioedema, and cardiovascular collapse. Bronchospasm and especially mucous membrane congestion or angioedema, usually maybe these symptoms, this response of the body will cause apnea for the patients is very dangerous. Some serious allergic shock can cause death. So at these conditions, select epinephrine first and the subcutaneous administration of adrenaline. It is the initial treatment. It's very important. It's very effective because, there are these mechanisms to explain why. Because, alpha-1 receptor induced vasoconstriction, especially in the small artery, this drug, based on this result, increase blood pressure obviously. So increase blood pressure and then increase the blood flow to the vital tissues. So improve the blood flow, blood supply to the vital tissues. And it also activate beta-1 in the heart, but delay the coronary artery. So this response is very useful to improve the cardiac function. It also can activate beta-2 receptor. Here it has a 2 result, bronchodilation, because of beta-2 receptor in the smooth muscle of the airway. This activation of beta-2, it also is very helpful to decrease the release of histamine. Do you know this substance? It is important allergic mediators in allergic reactions. So decrease the release of histamine. It is very helpful to correct this pathophysiological process. And the alpha-1 receptor in the mucous membrane induce vasoconstriction, so it can lessen edema and relieve dyspnea. The patient has angioedema when they have this allergic shock. This effect caused by alpha-1 is really useful. So that's why to correct the bronchospasm, mucous membrane congestion, even angioedema or cardiovascular collapse, this drug take onset very rapidly. This subcutaneous injection, there is effects takes onset very fast. So to save the patient's life from allergic shock, using this epinephrine is really important. So that's why this drug, we considered it is the first selection for this disease. Try to remember this very well, okay? Yeah, in the following chapters, you will study many drugs. When we mentioned in the treatment of some disease, we consider some drug as the first choice or first selection. So you must remember that. It is the important knowledge point, so master. Other allergic reactions like acute bronchial asthma or bronchospasm, this drug also is very useful. It activates beta-2 receptor, induce bronchodilation. It also activates beta-2 and then decrease the release of histamine. So to improve the symptoms of apnea or difficulties in breathing, is really helpful. So when you study the drugs used to treat asthma, you will study this drug, beta receptor agonist, again. Others, in the treatment of acute bronchial asthma, this drug can be administered subcutaneously or intramuscularly. It can take onset relatively fast. It also is very useful in the treatment of antineurotic edema and serum sickness. This antineurotic edema sometimes it also caused by some allergic reactions, and Of course, some patients maybe has this problem because of heredity. Yeah. So to relieve this edema, this drug is helpful because of vasoconstriction. In this serum sickness, it often caused by infusion of animal serum antibody. Yeah, so it also induces allergic reactions like this picture show. So the symptoms of the patients with serum sickness sometimes also is relatively dangerous. To correct these allergic reactions, epinephrine also is very useful. Because this drug can activate directly beta-1 receptor in the heart, so has observed positive inotropic chronotropic effects on the heart. So to correct cardiac arrest, this drug is very helpful. In the last section, I introduced isoprenaline. Isoprenaline is also used to treat cardiac arrest, but usually that cardiac arrest should be caused by heart disease itself, like serious AV blockade or AV node failure. But this difference, epinephrine can be used in different type of cardiac arrest, like some surgery accident or drowning, different conditions, cardiac arrest. This drug can be administered intravascular injection. So if there is no electronic pacemaker, intravenous injection of epinephrine to correct cardiac arrest is very useful, very important. So just now I said this drug in the treatment of allergic shock is the most important. Allergic shock and cardiac arrest, both of them are emergency. So in emergency, this drug is very common used. Very important to save the patient's life. Remember this. Next, this drug also used for local anesthesia. Usually, it should be dilated, like this time fold. Now, because this drug can activate alpha-1 receptor, it induces vasoconstriction. When it is used with some local anesthetics, this vasoconstriction can prolong the absorption of the local anesthetics. So the result is it can prolong the duration of anesthesia caused by anesthetics. So for this drug, epinephrine, usually used in combination with local anesthetics with short action duration. Similar to non-epinephrine, this drug also used for local hemostasis. Local hemostasis, usually used for the hemorrhage from mucus, nose mucus membrane of the nose, or gingival hemorrhage. Usually we use this drug diluted solution in the medical gauze, and then this medical gauze use this medical gauze to price the local region of hemorrhage. Yeah, this is local hemostasis. Yeah, I heard a story. A woman, she was almost 40 years old. One day, no any reason. Her nose was bleeding, and then she went to the hospital. Actually, after the measurement of blood pressure, she was diagnosed by hypertension. Now, the first symptoms of this hypertension in this woman, it is bleeding from the nose. So after that, the doctors used the medical cause dipped with this diluted epinephrine to stop bleeding for these patients. Yeah, this is local hemostasis of using epinephrine. Yeah, because this also is related to vasoconstriction caused by alpha-1 activation by epinephrine. Understand? Vasoconstriction. This means the broken blood vessels is closed, so stop bleeding. Next one, this drug, it also is very useful in the treatment of glaucoma because epinephrine, it can promote the aqueous humor to flow out by alpha-2 receptor activation. Remember? You studied the first drug is pilocarpine. Its clinical uses is glaucoma because it can also promote the aqueous humor to flow out from the eye globe. But the mechanism, they are different. Epinephrine because of activation of alpha-2, but pilocarpine because of activation of M receptor. And you also studied physosignin, cholinesterase inhibitor. It also is one useful drug in the treatment of glaucoma. So here, today, you studied epinephrine. Based on the alpha-2 receptor activation, it also is effective in the treatment of glaucoma. So this is the third agent for you to study for the in the treatment of glaucoma. This is the third agent you studied. Remember it, okay? So this is the clinical uses of epinephrine, including allergic reactions like allergic shock, acute bronchial asthma or bronchospasm, or antineurotic edema and serious sickness, and cardiac arrest caused by different reasons, and local anesthesia or local hemostasis, and glaucoma. So what are the adverse effects of it? These adverse effects also based on its pharmacological effects. When some pharmacological effects are not the objective of using epinephrine, they contribute to adverse effects, or even some overactivation of these receptors contribute to these toxic reactions. Yeah, now look at it. Maybe it can increase blood pressure, obviously. So marked activation in blood pressure. So for the patients with hypertension, give a great caution. Yeah. It also has a latency to induce severe angina or myocardial infarction. It has positive effect on the heart, increase heart rate, increase the cardiac cells contractility. So it increase oxygen consumption. Understand? So this result for the patients with coronary artery disease, maybe it can induce severe angina and even myocardial infarction. Maybe it also can induce sinus tachycardia or serious ventricular arrhythmias because positive effect on the heart. It also promotes AV conduction, has positive chronotropic effect. So it also has this latency of bad result. So therefore, special caution is indicated in elderly patients or those with hypertension or coronary artery disease. So for these patients, we want to use epinephrine to correct allergic shock, allergic reactions. Special caution is needed. Okay, that's it for this section. So do you know any other alpha beta receptor agonists? Alpha and beta receptor agonists also include dopamine, ephedrine, and other agents. Here, let me introduce dopamine. Do you still remember? I also has introduced the dopamine receptor in this chapter, because this dopamine, it can activate dopamine receptor, its own receptor. This receptor, it is the most sensitive to dopamine compared with other receptors, higher than the beta-1 and alpha-1 receptor. Can be activated by dopamine, but it is the least sensitive to dopamine. This drug can activate these receptors. Let's analyze the effects caused by this, especially in the renal vasodilation. It is the first effect caused by dopamine. This drug can activate dopamine 1 receptor in the renal vessels, induce vasodilation, especially renal vasodilation. So the result is increased renal blood flow. This response is very useful to promote urine production. Heart. Because dopamine can activate directly beta-1 receptor, it has positive effect on the heart. Increased cardiac output is very useful. And it also acts on blood vessels because of activation of dopamine 1 and alpha-1 receptor. But different dose, it induces different response. When dopamine used at low dose, it mainly activates dopamine 1 receptor, so induce vasodilation, decrease peripheral resistance. When it used at higher dose, it also can directly activate vascular alpha receptor, so induce vasoconstriction, especially the blood vessels vasoconstriction in skin and mucosa. So blood pressure increase obviously. So try to think of what conditions the body requires this result. Increased blood pressure. Yeah, hypotension. Yes, shock. Maybe you think of that. You have studied now epinephrine. The first clinical uses for the norepinephrine. Okay, don't forget dopamine. It is similar to norepinephrine, epinephrine, and isoprenaline. These four substances are catecholamines. Remember that? Because they are catecholamines, they can be metabolized very rapidly. So they have relatively shorter half-lives. So that's why to maintain its pharmacological effect by dopamine, we just administered by continuous intravenous infusion. And for catecholamines, they has relatively less penetration into CNS. So they have no ability to pass across blood-brain barrier. So dopamine mainly acts on the peripheral tissue. So this effect on the heart blood vessels, dopamine in the clinical practice, it is very useful and important in the treatment of cardiac cardiogenic and septic shock, and acute renal failure and acute heart failure. Shock, usually the patients with shock, they have hypotension. Try to maintain enough blood pressure to maintain the blood supply to the vessel tissue. It is really important. Try to avoid the damage caused by ischemia. So, continuous infusion of dopamine at relatively higher velocity, higher dose, it is very useful. And usually, in the treatment of shock using dopamine, the velocity of dropping dopamine should be regulated according to the blood pressure change. When the blood pressure increased to the normal state, maybe it also requires to continue use this dopamine. Don't forget, this drug also can dilate blood vessels in the kidney. For the patients with shock, sometimes they also have a problem of oliguria, even acidosis. So, because dopamine, when it used in relatively low dose, it mainly dilates blood vessels in kidney. So promote the urine production, and then promote the metabolized excretion with the urine. It is really helpful to correct the acidosis. It's really useful. And in the treatment of renal failure, it also is related to this explanation just now I gave you. And in the treatment of acute heart failure, it also is very important. One day you will study heart failure from pathophysiology, and you also will study the drugs used for the treatment of heart failure. Dopamine, it can induce vasodilation in the kidney to promote the urine production. So for the patients with heart failure, to correct the serous edema is really useful. Understand? Some patients have this heart failure. They have edema, cardiogenic edema. And sometimes that edema is difficult to correct. So this drug, when it is used in relatively low dose, for the relief of cardiogenic edema caused by heart failure, is useful. At the same time, it also can activate dopamine 1 receptor, improve the function of the heart. It also is helpful. So this drug is relatively commonly used in the heart disease. Okay. Next agent is ephedrine. Actually, in our China, ephedrine has been used for almost 2,000 years. This is the ephedrine herb. Its action mechanism of ephedrine is relatively complicated. Actually, it is non-catecholamines, remember? Non-catecholamine has relatively longer half-life, because in this drug, mechanism action is it can act primarily by promoting the release of stored catecholamines. So, like stored epinephrine as a neurotransmitter. So this effect is indirect. The neurotransmitter, not epinephrine, can activate alpha or beta receptor. This is the indirect effects caused by ephedrine. And these agents also can directly act on adrenergic receptor, including alpha, beta 1, and beta 2 receptor. So this ephedrine it can be considered as alpha and beta receptor agonist. Because it is non-catecholamine, this drug cannot very readily metabolized by the enzymes, so it can be administered orally, and it has relatively higher bioavailability, and it also has a longer duration of action, but it is relatively weaker than the other agonists just now you have studied, even including dopamine. Yeah. Because it's non-catecholamine, it can pass across BBB. So in the CNS, it has a mild stimulant effect. But this drug has tachyphylaxis. Remember this word? A rapid tolerance. So repeated use of ephedrine, its pharmacological effects will become weaker and weaker, even disappear. Yeah, this is tachyphylaxis. So for ephedrine, we should not use this drug in long-term therapy. Okay, clinically, the effects caused by ephedrine include cardiovascular effects because of beta-1 receptor and alpha-1 and beta-2. So has positive cardiac inotropic effects because of beta-1. It induces vasoconstriction, especially in the mucous or cutaneous tissue. Induced vasoconstriction is relatively obvious. This result has a significance of decongestive action. Beta-2 receptor activation induces bronchodilation. This response is really useful in the treatment of asthma or bronchospasm. Yeah. It has a stimulant effect on the CNS because it is non-catecholamine. It can enter blood-brain barrier and then enter brain tissue. So based on its pharmacological effects, ephedrine can be used to treat bronchial asthma, but don't forget it is not catecholamine. Its effect take onset slowly. So it also has mild effect. So this is just used for the mild asthma, not acute serious asthma, just used for mild asthma. Because of vasoconstriction caused by alpha-1 receptor activation, this drug can be used as nasal decongestant, used as local area of mucous membrane of nose, nasal decongestant, because of vasoconstriction caused by ephedrine to correct the mucous membrane edema in the nose and to improve the breathing. When some patients has cold like that, it's very helpful. It also works as a pressure agent in spinal anesthesia. Yeah, next week I will teach you local anesthetics, spinal anesthesia. This spinal anesthesia, some patients it is easily to induce hypotension because of anesthesia of the blood vessels lose control of sympathetic nerve. So usually it induces vasodilation, positive vasodilation caused by local anesthetics when the patient has this spinal anesthesia. So try to avoid that hypotension, to maintain enough blood pressure to maintain enough blood supply to the vital tissue. Even during surgery, it is really important. So sometimes just use this Ephedrine as a pressure agent in spinal anesthesia to avoid hypotension caused by anesthesia. It is not necessary to use epinephrine. Epinephrine, that effect is very, very transient. This drug is mild and lasting. So these conditions only use Ephedrine. Try to remember this, okay? And act on the heart, on the eye, it also can activate alpha-1 receptor in the sphincter, in the pupillary dilator, so induce mydriatics. So it also works as a mydriatic to enlarge pupil size. So it may be in the ophthalmology, it also is useful. Okay, that's all for this chapter. To help you review this chapter, I also give you several questions. These drugs are really useful in the clinical practice, especially some emergencies. Okay, that's all for this part. This is a table. Maybe it also is helpful you to review this knowledge. Okay, that's all for this part. Next chapter, you should study adrenal receptor antagonist. Do you know what are they? Yeah, based on the selectivity to the receptors, it includes alpha receptor antagonist and beta receptor antagonist. Okay, see you next chapter.